Number 4, changes, postponements, and notice of the next meeting. We have one item that we're going to add under comments by elected officials and commissioner liaison reports. We're going to have Susan Wheelan from Public Health, our executive director, is going to come and give us an update. And the next meeting will be March 23rd.
Good morning.
Good morning, commissioners. Happy to be here. I also wanted to thank you, Commissioner Vanderver, for taking the time as we did a ceremony last week with Mayor Suthers and to lift up all of the first responders, public health workers, healthcare workers with this past year, and appreciate that. And hopefully we'll be able to share a video at some time in the future of your remarks, and really resonated, you know, with me, and was very special for public health workers and everyone involved. So thank you for that. So Susan Wheelan, Public Health Director for El Paso County. I wanted to take the time to provide a timely update, as information is changing sometimes by the day and more so by the week. And I have some really hopeful news, as always, these days, because hope is on the horizon with so many, different tools as it relates to vaccination. And we've got 3 different vaccines now that have received emergency authorization use. And as part of our triple action plan for El Paso County and Colorado Springs, we are expanding vaccinations, and that's all dependent on vaccine supplies. And with this week, we have been working diligently with General Sherman as well as the State Health Department leadership to gain more vaccine supplies to El Paso County. And before yesterday, the supplies that were committed to us this week are 38,910 doses. And I wanted to make a clarification with the new mass vaccination site that is going to be up and running tomorrow. That will be the first routine, consistent mass vaccination site in El Paso County, operated by Centura. Is certainly is getting support from Public Health and also the Office of Emergency Management with that big of an operation. But that is something that is very exciting. So paired with the 38,910 doses, we will also get 2,000 more doses of vaccine, and that operation starts tomorrow. So part of the triple action plan for El Paso County and Colorado Springs, there's 3 components of it. The first component has always been that we're going to use existing infrastructure, our hospitals, our pharmacies, our healthcare providers, because we know that a mass vaccination site is not only in a parking lot. It can be in a brick and mortar through existing infrastructure. And as an example, the MAC, what we've referred to as the Memorial Administration Center with UC Health, they are doing upwards of 2,000 vaccinations per day as well. So wanted to provide that clarification, because sometimes you see in the news and the images that the parking lots are the mass vaccinations. There's mass vaccinations happening every day in El Paso County and Colorado Springs. So that's the first component, using existing infrastructure. The second component is using parking lots. And this one is the first consistent parking lot, but we know that El Paso County is vast landscape, and that potentially as vaccine supplies increase, we need to be prepared to expand north. And so just as we scouted out the World Arena and we advocated with the State Health Department and General Sherman to place a mass vaccination site at the World Arena, we are going to look up north and investigating, different options. And I will tell that the community has really responded, because Pikes Peak Community College, New Life Church, they welcome us to their locations. And what our emergency preparedness folks are doing are really assessing, what does the parking lot look like? What is it, inside? What are we dealing with there? And possibly, maybe Chapel Hills Mall, but it's an expansion process, part of that triple action plan. So that's the second component, to have mass vaccinations in parking lots. And the third component is addressing equity issues and reducing barriers. We know that there are language barriers. We know that there are technology barriers. We know that there are transportation barriers. There's numerous different barriers. So we need to make sure that we're innovative and we respond to the needs throughout El Paso County. And so that's that's our triple action plan, and we are expanding, and I think that that's very significant for El Paso County. And as the governor has mentioned, that by mid-April, all adults ages 16 years of age and older will be eligible, and we will no longer be prioritizing groups. And I think that that is great news for El Paso County because it helps in the planning process for vaccine providers to not have to be so specific about the priority groups. Now, the priority groups are needed because we know that more severe disease and illness occurs in our older population, and I am happy to report that new information with our data analytics that we are at, let's see, I believe it's, I don't want to get it wrong, 67% of vaccinating 70 plus the age group. And that's only with state supplies that we have visibility on with the CIS, the Colorado Immunization Information System. That doesn't count for federal supplies. So I would make the assumption that we're over that 70% goal, and El Paso County has achieved that because when you pair the state supplies with the federal supplies, that's going to bump us up a few percentages, and we are working with our partners who receive federal supplies, and we will make that visible as aggregate numbers on our vaccine data dashboard. So I think that that's something that is exciting to celebrate, that El Paso County has achieved that, working with the vaccine consortium to vaccinate ages 70 years of age and older. And I can tell you that I'm really happy because my parents, who are in their 80s, just received their second dose of vaccine and feeling great. And that actually gives me some relief for my parents. So that's really good news. 1 in 5 are vaccinated in El Paso County among the eligible groups, and our eligible population, when you take in consideration not everyone is 16 years of age and older, it's roughly 577,000. So 1 in 5 are vaccinated, and as you can tell, when we're expanding and vaccine supplies increase, we're going to be able to do even more with our triple action plan. So I think that that's encouraging as well. As production goes up nationally through the state and through us here locally, we've got some dedicated healthcare partners and pharmacies that are standing by, and they do a great job as part of that triple action plan, that we do education and outreach. We provide information so people can make informed decisions, and they gear up in numerous different ways to make the vaccine as accessible as possible in so many different areas in the community, and the vaccine is safe. And we want to vaccinate as many people as possible, and no doses are sitting on the shelf. We're getting out the vaccine as quickly as possible and as safely as possible. And another exciting point too is that you all remember that we recently purchased a new building in Fountain, the city of Fountain, which really takes care of the southeast portion of El Paso County. We are continuously developing partnerships, and this week we have developed, prior to this, a partnership with King Soopers, and they will be operating out of our building to vaccinate within the next few days. And the priority group's going to open up on the 19th to restaurant workers and to others too, so we need to make sure that we're poised and ready to do so. King Soopers on March 16th and 17th and March 18th will provide vaccinations with the Pfizer vaccine, and appointments still are available. And if people need vaccine, go to El Paso County health.org and sign up, or call an easy number with the Pikes Peak United Way 211 and get access in there. But good news, vaccine is increasing. We're expanding our vaccination plans, and so I think that that's really hopeful. Not to say that we're not going to have challenges ahead. We are still monitoring the variants worldwide and also in the state of Colorado and El Paso County. But I think that this is very encouraging and a lot of progress given where we were last year. Any questions?
Are there any questions for Susan Wheelan? I have one, but I'll reserve it in case others have.
I just have one.
Yes, Holly.
I was just interested, so when you say our federal partners, are you meaning the military bases and TRICARE and our veterans?
Yes, and we are working with all of the base commanders in the military. So it's the military, it's the VA, but it's also different entities like Walmart, and then there's the federally qualified healthcare center, which is Peak Vista. Now, some of those supplies we have visibility, but with the military and the VA in the CIS, the Colorado Immunization Information System. They're two different supplies, so they're not coordinated, and so we have to do that, I guess I would say, manually, and we work with our partners, and so we do know that that will kick up our percentage numbers as it relates to our vaccination efforts in El Paso County due to their efforts that it's affecting us in a positive way.
Commissioner Gonzalez.
Thank you, Mr. Chair. So thank you, Susan. I just want to thank you and staff of the El Paso County Public Health for all the great work you're all been doing. I know the time, the lack of sleep, everything you've been doing to help out and to save lives here in El Paso County is valuable, and I want to thank you. It's something I've been able to see and appreciate all the great work that you and others in our community have been doing for our El Paso County residents. I know some of the information early on, coming out of the state was, a little slow, a little janky in terms of understanding how the process is going on. So I'm happy to see that the communication's starting to improve, and we're getting better information, and that we've been able, with our local efforts, to help get that equitable distribution of vaccines, and seeing the increases for El Paso County starting to bear fruit. And so I appreciate all the great work that you and others have been doing, and so thank you again.
Thank you, Commissioner Gonzalez, and I also want to acknowledge that I appreciate your involvement and engagement on El Paso County's and Colorado Springs Vaccine Consortium that we meet on a routine basis, for those that don't know, every week, because this is a fast-moving process, and we appreciate your participation within that consortium.
And Commissioner Bremer.
Thank you. I will second my colleagues' comments, just of thanks to you and your staff. It continues to be the marathon, and we appreciate the energy and passion that you're still putting towards serving our community, and always pivoting, sometimes based on vaccine supply, sometimes based on changing rules, changing dials. I just appreciate the ability of your team to pivot very quickly, and to attend to the needs of our community and so many different groups, right? Schools, restaurant owners, business owners, those wanting to be vaccinated, those unable to access vaccine. You guys have it all covered, and I'm greatly appreciative of that. I did want, if you wouldn't mind, just a quick clarification. I heard you say the number 38,000 or somewhere around 38,000 vaccines coming this week to El Paso County, plus the 2,000 for the new mass vaccination clinic opening tomorrow. What can you tell us how that compares? Like what a large ramp up that is over what we've received, like for example, last week or the week before. If I recall, it's a pretty significant jump, like thousands of doses more than in previous weeks.
And so, I mean, we first discovered the discrepancy back in early February. And so we had been receiving some increased vaccine supplies the week of February 8th. And then the following week, I think it was February 14th, where we had that winter storm and there was no supplies of Moderna. And as you say, changes in pivoting quickly. This past weekend was a big snowstorm, and we had some clinics that needed to reschedule, and so therefore they didn't happen, such as UC Health, which is a powerhouse of a mass vax. So some of those numbers that we will see in the coming weeks will be 7,000 to 8,000 doses more. And to give you an idea of what we'll be able to ramp up to with the expansion of the mass vaccination site at the World Arena, paired with the increased vaccine supplies. And this is just the start, because I do foresee in the future we are going to have to pivot and provide more increased vaccination sites as well as volume, because we're going to have a lot more supplies if what is being said federally is going to come to the state and come to us locally. So currently, on a daily average, we're able to do 3,300 vaccinations per day. That is going to jump to about 5,300 per day. Now, there's 5 days a week operating, and there's 7 days a week. A lot of this is depending on staffing at El Paso County Public Health. For the fountain building, we want to get that up and running 7 days a week. We have also put in requests for the State Health Department to provide staffing on the weekends in April and May. So it's depending on if we're able to get some of that staffing. This weekend coming up, we are also doing some equity clinics, the second dose, simultaneously with Peak Vista, UC Health at the South Y on Jet Wing, and then at the fountain building. And so the State Health Department is going to send us 8 vaccinators. So we're not only, getting increased supplies, we are asking for additional staffing and support there. And I will say, when we had asked General Sherman and some of the CDPHE leadership to have a vaccination site in El Paso County, that wasn't a done deal. Through our partnership and engagement and communication, they've placed one at the World Arena, and they've taken our direction on that. Now, I do want to acknowledge that Centura is going to lead that effort, and I think that that's really important, that we have our, two of our big hospital systems here really operating at high levels to serve the public. So I think that that's really great. Now, our capacity currently with the existing infrastructure and what we have, it's we can do about 42,000 vaccinations per week, and we have a plan that ramps all the way up to I think it's 121,000 per week. But we've been working with some planning assumptions, and that all goes into vaccine supplies, staffing, and it's certainly a partnership. But we know that we have one of the largest populations in the state of Colorado, if not the largest population when the census catches up, and we need to be ready and poised and offer vaccine as quickly and safely as possible to those that want it. So we do have plans in place to ramp up, and that's not in a silo with only local public health. I mean, that's with a state partnership, the Pikes Peak Office of Emergency Management, our vaccine providers. So it's very vast related to being prepared and doing what we need to vaccinate. And we know that that's the special ingredient to opening more businesses. When you say pivot, again, the dial 3.0, I mean, there are stakeholder meetings and discussions that are happening that will expand the openings, and I think that's going to be coming soon. That is at the governor's direction. However, everything that I'm hearing is that it's just only a matter of time before we're able to open it up even further. So it's all connected: public health, businesses, and the health of our community, thriving economy. So that was more than you asked for, but hopefully that answered your question.
Well, and I haven't asked any questions yet either. So, Susan, I just want to say thank you for your coming and giving us a quick update. And you mentioned it a little bit about our event at Pioneers on Friday. That was a special event. And of course, it was talked about extensively in the press. Obviously, it was to remember those we've lost. And that was done on the 12th of March, which I believe was the one-year anniversary of our first loss. So that was an important date for us to remember. But at the same time, it also thanked so many people in our community that have been working so hard at fighting this battle. So as you know, And for the record here on the dais, the Colorado Springs City Police as a team was recognized. The Sheriff's Office and all of their employees were recognized as a team. All of the healthcare workers in our community was recognized as a team. And also Paso County Public Health was recognized as a team. And I'd like to emphasize the word team. That is so important for us to get things done. And then with good leadership, teams are very effective. And I think we have great leadership, including yourself, Susan, but really so many others. We have great leadership in our community that's doing incredible work. And let's talking a little bit about incredible work. You mentioned, I think coming this week is 41,910 vaccines. And of course, we're going to get those into arms. Now, when you think about that, over 40,000 shots in a single week, that is a serious amount of effort. And the community and the teams here have really stepped up to that. I think that's really important. And then, we've talked about kind of mass vaccination sites. I got to take a tour, of UC Health. So as many of us have before, that's really been a mass vaccination site for weeks now, doing about 2,000 a day. I think it's 6 days a week, maybe 5 days a week, or what's the 5 for?
I thought it was 5 days.
Oh, 5 days a week? Okay. So 10,000 shots a week is what they've been administering, and that's also, a really big number. So, we've been a lot of ongoing conversations with the Colorado Department of Public Health, including several last week. I think they are really stepping up. Kind of my generalized thought, you said increase of about 7 to 8. I think we were doing around 30,000 a week previously, and now we're doing, maybe we might be stepping up to around 40,000. So I'm not sure it's just 7 or 8. I think it's actually a little bit more, maybe about 10,000 a week, at least maybe for several more weeks. So from that, and being thankful that is now happening, and also providing some labor resources to allow us to get to that, I think it's very appropriate to thank CDPHE for their efforts in helping to step up and work with our community. It's not like we always agree on everything, but it is really important to thank anybody that's really helping us out. And I think that that increase in vaccine is a great indicator of that willingness to support. So I just want to thank CDPHE as well for the work that they're doing. And I think it's fair to mention, while we have a lot of really difficult work down here, think about being in that office, the Colorado Department of Public Health, trying to help 64 counties at the same time. We can have our challenges, we can have our issues, but this is not simple work. And this is work that the state is trying to grapple with, as well as the county here. And I think it's just important to recognize that. One last thing, I know the governor's been talking about this dial 3.0, and I have one question about that. I am hopeful that in 3.0, I'm not sure we know exactly what's in it in 3.0 yet, but maybe you might. Is the state going to remove numbers limits in 3.0? Because, we've got 5-star program, we've got all these other things, they're all working on these numbers limits, but the COVID numbers plus all the numbers of vaccines that have been administered, we might be able to remove those numbers limits. And those would be for bigger venues, right? It doesn't mean eliminate mass. It doesn't mean eliminate social distancing, but maybe eliminate the numbers limits. Is that a consideration by the state? Do we know?
I know that the State Health Department and the governor's office are doing stakeholder processes. And I know that there was, one yesterday with the Municipal League and their CCI and just numerous meetings that are going on. I do think that, it has been discussed to eliminate caps. But what is critical is to continue keeping the physical distancing, the quality of physical distancing. However, I'm not sure when, what the results are going to be. I just know that if we continue to see our vaccinations go up and communities are protected, and we see that there's still monitoring the new variants and that our metrics are staying low, then we're in a good situation. So yes, to your question, I do think that will be a component of it, but I'm not sure quite what the results are going to be of that.
Thank you. I would encourage the state to seriously consider that. And of course, we're not out yet, and as you mentioned, we still will have challenges. That is absolutely true. Social distancing is the most important thing to do. Masks are an addition to that to help with that. But I think we're at a time where removing the caps is appropriate, and I hope the state will do that in Dial 3.0.
I think that might be coming. And I also wanted just to add to your comment about the vaccine, because context is always important, especially when information is moving so quickly. And so when you say, let's just say that 7,000 to 10,000 doses per week increase, of the increase, because with some of the numbers that we have, it's 28,000 that we've been able to do per week, but we can ramp all the way up to 42. And this week, context is important too, because UC Health and some others had canceled their clinic to reschedule. So that means that they only have so much staffing to provide the vaccination. So we're going to get an increase, but then they also need to reschedule those vaccinations, and they're operating 5 days a week. The goal is for the mass vaccination site to operate 6 days a week. We are following the FEMA framework, and Centura did get that contract through the State Health Department. The goal is to ramp all the way up to 6,000 vaccinations per day. That's what they had to demonstrate within their proposal that they would be able to do for El Paso County. So I think that that's significant. If we're able to operate our mass vaccination site at the Fountain Building, and let's just say, 2,000 to 2,500 doses per day, 7 days a week, mass vaccination at the World Arena 6 days a week, 6,000 doses, the UC Health vaccination, 2,000 per day, 5 days a week, and we've got all of the other existing infrastructure doing a great job, and then we're also going to be able to look at expanding in different portions of El Paso County. I think that's all good news for El Paso County and Colorado Springs. But context is important, because there's so many different factors that go into so many different components of this response, whether it's the disease burden or vaccine supplies. It's really important that there is context. So thank you for that, and I will relay your feedback to the State Health Department about the Dial 3.0. I believe that the cutoff for feedback is by tomorrow morning, Wednesday.
Great. I guess I didn't even know there was a deadline on Dial 3.0, so thank you for carrying that message for me.
Well, and I just kind of listen to what I hear in different settings and kind of make assumptions also.
Thank you very much. Yes, Commissioner Gonzalez.
Thank you, Mr. Chair. So I did provide some feedback on the dial on Friday with the CCI call.
Oh, excellent. Thank you. Any other comments? Susan, thank you so much for the update. We appreciate your coming this morning to do this. We know how busy you are, and keep working hard at it. I'm sure you and the great team will continue to do great work here through the spring and the summer.
Thank you, commissioners, and local public health really appreciates all of the support from every single commissioner on this board. So appreciate you.